Hi, today we want to talk about the sacrum, more specifically about the sacral hiatus. This is a sacral. It is triangular bone located at the lower end of the spine. The sacrum acquired a unique name from the Roman os sacrum, who translate the bones as holy bones. When you see the sacrum at the posterior surface, there is a sacral hole between two articular processes. It is the entrance of a sacral canal that holds the spinal nerve. It follows the sacrum's body beneath the sacrum. The gap is formed when the spinal column of the fifth and sometimes fourth sacrum is not fully engaged. This is the sacral hiatus. The shape and size of the sacral hiatus depends on the number of pieces that are not fused from the midline to the back. This feature of sacral hiatus is important managing tail epidural anesthesia. A tail epidural shot is used to treat the sacrum and lower lumbar nerve root collision through sacral hiatus. The sacral hiatus contains lower sacral and coccygeal nerve roots and fiber fatty tissue. In recent research, the hiatus is covered by superficial posterior sacrococcygeal ligament, which is attached to the margin of the hiatus, and the deep posterior sacrococcygeal ligament attached to the floor of sacral hiatus. When the spinal cord ends, another group of nerve, which is coda equina, continues down the spinal canal, and many nerves of the coda equina at the lower spinal cord pass through the sacrum. These nerves enter the sacrum through a sacral canal from the vertebra of the lumbar spine. From the spinal canal, these nerves come out through the four pairs of holes on the side of the canal, which is the sacral foramina, or through the sacral hiatus.
Okay, so now that we know a little bit more about the anatomy of the sacral hiatus, we're going to be talking about its clinical relevance. So in multiple studies, doctors and scientists would take measurements of the sacral hiatus to help analyze how they could better inject an anesthetic solution called caudal epidural anesthesia, also known as CEB. CEB is widely used for prevention of chronic lower back pain and for the control of intraoperative analgesia. CEB is an anesthetic solution that is injected into the sacral canal via the sacral hiatus. For optimal access into the sacral epidural space, detailed anatomical landmarks are required. Teams of scientists and doctors continue to study these various landmarks of the sacral hiatus to better conduct surgical procedures involving needle insertion via the sacral hiatus. For example, they measure and take the averages of how inverted the sacral hiatus is, the average length, the average distance of the intercoronal distance, as well as the average of the apex of the sacral hiatus. It is necessary to have this detailed knowledge for optimal access into the sacral epidural space because there's so much variation between individuals. Because of this wide variation, there is a 25% failure rate of caudal epidural block that has been reported in literature. The failure rate of this procedure may be due to the various anatomical features of the sacral hiatus. This is why knowing the anatomical variations in shape, size, level of apex, and base of sacral hiatus is of importance to clinicians to reduce failure rate of caudal epidural block. So you can see how important it really is to be aware of all of these features and how to apply this knowledge in a clinical setting.